Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode. Thank you for joining another episode of the Optimal Bio podcast. Today, I am joined by Irene Burns, who is the PA in our Pinehurst location. And today, we're going to hear more about her story and talking about PTSD and TBI. So thanks for joining us today.
Thanks for having me again.
I think which would be helpful before we jump into PTSD and TBI and how we treat our patients is kind of taking a step back and going through your background and kind of what brought you to Optimal Bio.
Okay. So I've always been interested more so in women's health than anything, and honestly for the hormone aspect of it. But I started looking more into testosterone, which also is a woman's hormone, but we'll get into that later. But I started looking more into testosterone because of my husband. He is in the military. He's been in the military he just retired, but he was in the military for 27 years, and 20 of those years was with special operations. And there's a lot that comes with that, but I'll go over all the symptoms and things in a minute. But I started looking at testosterone because of him, and initially he started using testosterone injections, which were helpful to begin with, but then there's a lot of adverse effects that come with that, the ups and downs, and even more mood swings, things like that. So this has been literally life-changing, and I hate to say that out loud because people think, oh, she's just lying, trying to, I'm like, I wait until they feel it, and I'm like, I know.
Yep, exactly. It's like I wasn't just making it up.
So, but it really has been life-changing, and all of the symptoms that I'm going to talk about, it's not just the person that's experiencing them. There's like a ripple effect. You got to think about their families at home, their communities, things like that. So it helps not just the single individual.
Absolutely. And that's like health in general, let alone what we're going to talk about. Health impacts everything. It impacts relationship with yourself, your family, your friends, how you show up at work, how you show up at school, wherever you may be. But I think people forget the impact that health has on every single day.
Always.
And for those who don't know, we do a lot of work with the military, especially in our Southern Pine / Pinehurst office, whatever you may want to call it. And it really was such a gift that Irene is the provider in that office because she has her experience that can help, our patients. And a lot of, the patients that we see in that office and across all offices are coming with PTSD and TBI, and we're going to jump in and talk about that today.
Yes, a lot of people, because it's kind of like a silent disorder, if you will, you can't see it, right? Like they're not, I don't know, all yellow from jaundice or something like that, but it's just like internally, but everyone can feel it. They can feel it in their families, things like that. But PTSD, the definition of it, it's just a set of symptoms that someone experiences after experiencing trauma of some sort. And these symptoms can come up a week later, years later, nobody knows. And usually when people think of PTSD, they're thinking just like either military, but women experience, like there's all kinds of reasons. Trauma to everybody is different. It can be something that I think is like not traumatic, but it's traumatic to that person. But I have focused a lot more on PTSD in the military and then also with the TBIs because they go hand in hand. Mm-hmm. And the other thing is typically people who have PTSD, they will have they'll be like hyper vigilant. They are constantly like on edge, things like that. And they're just like constantly thinking about the traumatic experience over and over. But with the community, the soft community, special operations form, they don't necessarily think that their trauma was bad. They actually like, I don't want to say enjoy, but they like that action. That's not something they perceive as being traumatic. Um, but I still think it is, because I don't think that we as humans are, no matter if it is something that you enjoy doing, if you will, but you're doing it for a good cause, it doesn't matter. Like, we're just not made up to experience things like that.
Absolutely. I even talk, and this is totally different, but like the video games that people play and like killing people or watching people die, I'm like, our brains are not supposed to see that. And they just see it over and over and it becomes normalized.
Yes, just like, I don't know if I'm not, the recent assassination, like I'm scrolling through my Instagram and you see the actual assassination, and then the next thing they're selling me a purse or something like it's totally normal. I'm like, wait, why did I just see that?
Our brains are not supposed to see that. And I think, especially like talking about special forces, their threshold for stress is so high, and that's why they are in special forces. So even though they may say, I'm good, this is my job, this is what I'm supposed to be doing, they don't realize subconsciously what it could be doing to their emotional health, physical health, and mental health.
100%. And we just talked about cortisol last week. So what's going on with these traumatic, what's happening when it's like sitting there in the back? That's what it's cortisol. It's right. It's like suppressing everything the same as we talked about. But
And like you said too, so many times they look like completely normal, healthy people, which I think makes it even harder. And they're very type A driven people. So just that combination is just gonna be like pushing down, down, down until there can be some very serious consequences.
yes, they look extremely healthy. I mean, you guys see them and
Coming with like 7% body fat, like,
they fit all the things. And I mean, even some people who've worked here in the past, like patient coordinators, they didn't think they needed testosterone because of the way they looked. And I was like, it's not just for muscles. Testosterone is not just for muscles.
it's like a nice added benefit, right? If you're putting in the work elsewhere.
Yes, that's what I tell everyone. It's not just for testosterone or for muscles and libido. It does so much more. That's a great little pro over here, but that's not what we're here to do.
And I tell people that because I think that, like, oh, testosterone, like sex and looking good, or you want to feel 20. And it's like, no, and we'll dive into it, but it's like being healthy, feeling good day to day. I'm like, if you're a patient, you realize those are like nice added benefits, but it's not why you're coming and staying.
It's literally quality of life, like just in general. It's not going to keep you 20. You're still going to age. You're still going to do the things, but you're going to,
And honestly, who wants to be 20 again? I would rather keep aging gracefully.
yes. Um, but so a lot of, like we were talking about the soft guys, they experience so much combat. They're gone. I think there was a paper that said in 10 years, it's not uncommon for them to have like 15 plus deployments. And you're probably like, what? How is that possible? Like, these guys, when they go, it's not for like the typical 12 months to 15 months that you hear about. They're going for shorter periods, but they're doing stuff that whole entire time. Then they come back and they don't get a break. They're still training, and their training is crazy intense. Like there was a study that said, we know we're going to talk about TBIs in a second, but these guys are like 85% of them get a TBI just in training. In training, not even.
And it's your brain. Like, it is your brain that controls everything in your body.
And that's where, I mean, well, we need it for cognition and things, but our little pituitary gland is right there. And when I ask the guys, I'm like, oh, okay, have you ever had any TBIs? Immediately they're like, no. I'm like, okay, I don't need you to tell me that they're documented. I just need to know if you had a TBI. And then sometimes they'll still say no. I'm like, so you don't do any breaching, blast exposure? They're like, well, yeah, but I've never been knocked out. And I'm like, it doesn't matter. It's like that's even worse. I don't know if you remember the picture I showed you guys. Like the brain with the blast exposure, the scarring is insane.
And that's like, how many times does that happen with them, right?
Yeah, over and over.
And then everything else that goes. So, and when you're talking to these patients or just people in general, how do these symptoms like present?
It's it's weird. It's not weird. It's just different. So they will still continue to give their all at their job because that's just who they are. It's when they get home. It's their mental, not as well, cognition, of course, brain fog, but their mood. They they feel more anxious and not in like the way that you and I would probably think of it. They just don't have the confidence that they used to have. Like they will be very irritable with their families at home. So it's more so at the house because that's where they can let their guard down kind of, but they're still 99% of the time they're still going to say, "No, it's not a TB, it's not PTSD, it's not a TBI."
Because like saying that and saying your symptoms is not. I feel like you feel weak then, right?
That's why they won't. I'm like, "Okay." I love it when their spouse or their partner comes in with them 'cause they'll tell me their mood is great or there's nothing wrong with them. And then I look at their partner and ask, and they're like, "Well,
Exactly. And they may not connect, right? From PTSD or TBI. Oh, that's why I feel this way. Or if all their buddies feel that way, they may just think it's part of their job, right?
yes." And then we can go into that, like the common same thing as like when we talk about reference ranges, right? Just because it's common doesn't mean it's normal. So the behaviors and the way you feel, because it's common in your group or your community, does not mean it's normal.
Absolutely not.
And then just like when they get home, they're just tired all the time, and they'll say, but were you tired before? Were you when you got home doing the same exact job?
Exactly. Exactly.
Something else is.
100%. Or thinking about the suicide rate.
Oh my gosh.
It's people talk about that all the time, but it's like, well, let's talk about why and how can we help try to prevent it. Of course, there's many aspects that go into it, but that conversation needs to be bigger.
Yes. So again, we were just talking about weakness. It's very difficult for them to open up, period, because any emotion is seen as weakness, if you will. They don't want to be sidelined from deploying. They don't want to be taken off because whatever. So they just keep it. And then they go through this whole time. And I'm going to talk about the retired guys for a quick second because they're like in this brotherhood and always go, 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 whatever at work. And then they retire and it's over. There's nothing.
Yeah.
And then all of it comes up, but they have no one to turn to because they're no longer part of that. And the VA, sorry, let me go. They're they're now caregivers also don't care. It's all written. It's like an SOP. I mean, I can tell you exactly what they're going to do step by step because they're going step by step. It's not patient dependent. They're not listening. They're just like, oh, here you go. Here's some SSRIs or some antipsychotics. Like they're not addressing the root cause. It's so frustrating because I see more suicide in the retired guys than when they're still active duty. And then that's even worse on the family because you got to think. I'm not just talking about then, but they've gone through all of this, and it's supposed to be the good times, and it's not.
And how many times you worry when they're being deployed, right? And like probably take a
Take a little breath, you know.
breath, like, okay, they're home.
It's not good. But I think that we have to talk about all the things that come with the PTSD and the TBIs. It's not just mood. So what happens?
Yep.
They're not sleeping well anyways, just in
Mm-hmm.
general. So a lot of the community increases their alcohol intake
Mm.
because a lot of people that's what they do anyway, self-medicate.
Yeah. And it's celebrated too. Like it's normal, right? It's a normal thing. Not think about what it can be doing to your body.
It is I can't explain how common um, alcoholism is in this community, but when you're part of it, you don't think it's alcoholism.
Exactly.
And I'm not saying that in a negative, like, because my husband and I, we drank a lot, like we did, because that's just what we all did.
Right.
The women, we're stressed, we're constantly on edge,
Absolutely.
and then they're the same. And then when they come home, we just do it together. And the amount of alcohol that's being drank is not, it's not even within the normal limits, but we think it's normal.
Especially then you put that on PTSD, TBI, and then it's just like gasoline to a fire.
That's the whole thing because it just like keeps on, but you don't see it.
Right. Absolutely not. Yeah.
So it's just disrupting the sleep even more because we know that already. And so what happens with that? Your testosterone drops even more, right? Your estrogen, well, the guys especially, the little bit of testosterone they're making is now becoming more estrogen than the DHT, which we know is going to cause even more moodiness, right?
Right. Exactly.
And then, of course, like I said, the irritability and things. So we have all of this compounding, and instead of maybe trying to start with a little bit of replacement of what they're missing, it's a band aid.
It doesn't work out well.
No, it's very, it's, well, you know how I am. I'm passionate about women's care too, but it's the same. Like, nobody's doing the proper research, if you will, and we're not treating the actual problem, and everyone's suffering.
Exactly. And they're going to the doctor, right? And they're being told to numb and they don't even know it. So then it's like, where do you find, patients that we see? Usually they've gone to multiple doctors.
And how do they hear about us? From their friend who's somehow found us from somewhere. And then it's like, which I'm so glad that they actually do talk about that because here it's funny because in my office I'm like, how'd you hear about us? Oh, my buddy. If I hear somebody say, oh, Google, I'm like, oh wait, what?
Exactly.
But I'm glad that they're spreading that because it is helping people. It's helping their families. It's helping relationships. Oh my God. I told you the divorce rate in the soft community is ridiculous. Like in some units, it's over 90%. Like I can tell you just in our where we're at or where we were at, it's probably close to 95%.
That is so sad.
Like, I mean, it is. And I honestly, like you can ask Xavier how we're still married. No idea. Like it's crazy. It's hard.
And two, then you have two people suffering now separate, right? You came and tried to heal. Now you're adding the divorce on top.
And then most people have kids.
Exactly. Yep.
So who else is that affecting? And then it just continues on generational. So, you know,
And then, you know, most people try to go to the VA, right? And it's here's SSRI. Oh, we'll talk to you in 7 months. And it's like, okay, so these men and women, are fighting for our country, and then that's the care they're going to get. Whenever I see like a homeless person that's a veteran, I'm just like, oh my goodness, like so many things.
and let's talk about if they do decide to maybe help them with some testosterone because they are crazy low. Like they have to be extremely low for them to offer them testosterone. How do they prescribe it? They give them an injection. I've seen it once a month. Let's talk about that. Um, what it what's the half life of an injection, Tyler? Like 3.5 days.
Yep, best, right?
So we're gonna give somebody like a nice little boost for 3 days a month.
Talk about adding to the roller coaster.
It just blows my mind because if you're prescribing something, you should know how it works. And the study, all the research shows exactly how it works. So prescribe it appropriately.
Exactly. Exactly. When it can be so, so helpful.
It's I can't like it's just so frustrating to me when I see that.
So, how does testosterone help with one, PTSD and TBI?
Okay. So for because the TBIs and PTSD go together, and it's significantly the symptoms are significantly worse if they have a TBI, right? But that mood thing is huge, right? So you start the testosterone, that's going to help with their mood. But also, what happens when you replace the testosterone? It helps lower that cortisol, that stress. So things start balancing back out. So their sleep is better. their cognition is a little bit better, their overall health. Because then think about this: you're not sleeping, you have depression, you're not doing the same physical activity you used to do. What happens? You start gaining weight, then you're more down on yourself. Like there's it's a whole snowball effect. It's a little bit of testosterone, right?
Yep. Yep.
But we also know that not only is it symptomatic, like helping you, like things that we can't see it's doing. So the inflammation decreases that overall throughout your body, but think about the neuroinflammation, heart protection, bone health, all the things, lean muscle. My one of the peptides, well, for the guys who have TBIs, I always talk to them about Samorlin because when you have a TBI, it typically disrupts your sleep where you're supposed to be releasing, when you're sleeping, you're supposed to release your GH or growth hormone. And if you're not releasing it appropriately because you're not sleeping well, then your cognitive ability, the decline, the same things as like low testosterone, lean muscle, all the things. I always talk to him about that because Samorlin, it is the best thing for sleep ever, I will tell you.
Love that.
But a lot of the guys, I'm just gonna talk about my husband for a second. Like he has multiple TBIs, all the things, and just seeing his now that he's retired, the vestibular or like the balance issues, it's ridiculous. Like I thought it was fake when I was in school learning about this stuff.
I bet Ray's like, okay, but then seeing it,
Like when I was doing I was just doing a neuro exam on him at home, and he cannot close his eyes and stand in place. Like he's like all over the place, like all of this damage, and it's better now. He takes some Orlin as well, but his testosterone's much more stable with the pellets. I will tell you that. Also, when he was on injections, his blood pressure went through the roof. At one point, he lost vision in one of his eyes. Yeah, while he was deployed.
I mean, I don't even know what to say to that. It's,
I was like, that's probably not good.
yeah, it's probably not good. It's really good to see, especially when you're deployed.
That's what I said. So it was interesting. But also, why is that? Because he was getting his testosterone injections, yes, from a medical provider, but one that wasn't monitoring him because it was just one of the online places. Um, but also the vitamin D. Talking about vitamin D. Vitamin D is crucial to so many things, right? But when people think about vitamin D, what do most of them think about? Bones. That's it. I mean, yes, please let's keep our bones strong for sure.
Yes, bones are important.
That's why I'm always like, all it does, and I'm like, well, not all because you do need those, but vitamin D does way more, and it's not even a vitamin. They've shown that it's a hormone, a steroid hormone.
I know to tell people, it's like, yeah, they misnamed it, and then they realize it's a hormone and they never changed the name. It's like,
Yeah, they were like, wait, what? But so what else does it do? It helps with the immune system, of course. It lowers your risk for all those cancers, but it's going to help with that inflammation again that I was just talking about. Inflammation is horrible for us. Who's not inflamed? Well, hopefully not everyone, but
exactly. But that's the thing is like the even, the best that you can do, just the environment that we live in. And so that's why it's so important to have the tools to help you lower your inflammation.
yes. And then with these are testosterone, Samorlin, vitamin D. There's a lot of other things that I can go through in a sec, but it's not a one size fits all, and it's not going to fix you overnight. Like there's other things that people have to do. They have to do the work. Whether you have a TBI or PTSD, and I give you hormones to replace them, you still have to do your part. Like
Absolutely.
lifestyle matters. But with the PTSD and TBIs, they likely should have like a multidisciplinary team. So like maybe a therapist to talk through these things that they think are normal
Absolutely.
because it's gonna come up eventually. It will.
It always does. It always does at some point.
There's like so the stellate ganglion block, have you heard of that?
No.
So it was originally for like chronic pain, and it's a injection, like a numbing injection they give at the stellate ganglion nerve. But there were studies that showed if you do it on both sides within, I want to say it's like a week or two of each other, it helps reset like your vagal nerve. And so It's supposed to help with like PTSD. Again, it's like what I'm like, you have to do the work after you get it, you know?
Absolutely. Anything in life that's good, you got to put in some work.
So like there's lots of people I know who've had it done, and if they do the work, it's great. If they don't, once it wears off, you're gonna just go back to same old, same old.
And that's the thing, it's like with testosterone, somorelin, vitamin D, like those are foundational tools that if you don't have, you're just going to be on this hamster wheel of not being able to heal. But then you have to work with the tools, right? Go, like that's what we tell like even all of our patients. Like if we give you hormones, you don't get outside and go for a walk and you're eating McDonald's, we're missing so many pieces.
Exactly. I'm like, it's not just like a
Yeah,
magic. Like, why am I replacing this for you right now? Because of our life.
exactly.
Well, our environment, like the new lifestyle.
And anything that's saying otherwise, you probably should avoid it.
That's what I like to say. If it's a fast fix, it's probably not good for you,
No.
really. Even though we all love that instant gratification. I mean, Amazon ruined it for us.
Amazon, or even talking about social media again, right? The engineers get paid more for how many people are on it for longer. Like they know how they're trying to, our brain to react for that instant gratification.
Yeah, it's our world.
It is our world. But it's incredible to know things that we can avoid, things that can help us, right?
Yep. So, a lot, like one of my biggest things, and I don't ever tell anyone to quit drinking because, like I told you earlier, like the amount of alcohol people drink in this community that I know of, it's quite excessive. And what is the only drug that you can die from if you quit cold turkey?
Alcohol.
So that's my biggest thing. I do talk about what's going on in the body with it and maybe slow down a little, cut back. But that's one thing I will never tell somebody to quit straight off.
And hopefully, too, once you explain, I think so many people don't even realize what alcohol is doing to you or how it may make you feel. So I think, why the why is always so important, but especially with this is like understanding like, oh, this is why I may be feeling worse when I drink or my anxiety is heightened, my depression. So it's like just understanding and then feeling better with the hormones, then hopefully they'll be on their own journey to pull it back.
Yeah, because like we know sleep is like key to like everything, right? So, okay, why are they drinking excessively? So, likely one to numb some stuff, but also they're trying to go to sleep. So they'll drink, and then, dear God, I can't tell you how many people have taken like Ambien with their alcohol. I'm like, please don't do that. That's one thing I'm asking you not to do.
And we see that totally different conversation, but so much with perimenopause and menopause too.
And I'm like, well, how do you feel when you drink or take Ambien? Do you feel like you slept well? And they're like, no. I'm like, yes, because you're absolutely not. I was like, alcohol's doing this, but Ambien's just sedating you. You're not, nothing's happening there. That's supposed to.
But you go to the doctor, I can't sleep. Oh, here's Ambien.
We should maybe talk to them about, I don't know, sleep hygiene.
Absolutely.
That's like, that blows my mind where when people tell me like, oh, I went and I said A, B, and C and they gave me medication, I'm like, well, did they talk to you about maybe like lifestyle changes first? No.
Like maybe not drinking caffeine in the afternoon, getting off your phone, taking magnesium, working out. Yep. Anything.
Oh, here you go. Here's some trazodone or here's, like whatever. And I'm like, well, how about we talk about other things we can do so you can actually get good sleep?
Exactly. We could talk about this for so long. It's what, we tell everyone like, you have to have sleep. You can't outwork sleep. You can't outwork out sleep.
Hmm. Oh, I saw, and I've read the paper too, but like I said, if you get, I'm going to say like 4 or 5 hours of sleep, obviously, our cognition's not ideal and things, but there's a study that said if you take creatine, it'll help I can't remember how much percent your cognition returns. But I was like, don't say that because then now everyone's going to like not sleep and take creatine thinking that it's just going to fix the problem all the time.
Mm-hmm.
These studies have to be like put out in full, not like a little tidbit.
Exactly. And again, it's a piece of the puzzle, not the one thing that's going to fix it.
Sleep is sleep is key, always. I never realized myself how much important it was.
Oh my gosh, me neither. But then once, because I'd be like, oh, I can be, stay up till 2, be fine the next day. But then once you find out what sleep does, to your brain, to your skin, to your gut, I'm like, oh my gosh. And now I'm like always counting back my hours to make sure I get like 8 hours, it's funny.
The other peptide that we can do for like TBIs is BPC 157. So we only have oral BPC 157 now because, the FDA and their ban of many, many beneficial peptides. Um, but they actually did a study on mice and it showed that when they induced a TBI. I won't tell you how because it sounded very horrible.
Little mouse.
I know. And they gave certain ones the BPC and some not. The ones that were given it, their lesions healed much quicker, and also the inflammation went down way, way faster. So the oral, it does go systemic, but it is more focused on gut health, which, of course, gut health is important too, just in general for all of our hormones. So, but that's a big one.
Hopefully, the injections will come back soon.
I know. Because they're also like great for other injuries. We talk about that all the time.
And we've seen that so many times with our patients, or even some of us that needed to use it. You heal so much quicker.
It's frustrating, but anything that's gonna keep us healthy and off some FDA approved medications typically is banned or put on a let's wait and see.
So, what would you say to someone that may be suffering from PTSD or TBI, or a relative or a friend?
Well, if I felt they were, because I would tell you that more than likely they're not going to tell me that they're feeling this way. Um, I would tell them to listen to their partner because if their partner's telling them something's going on, and then B, just reach out. Like, it's okay. We can just talk about checking. We don't even have to talk about what happened. Like, doesn't matter if you're not feeling yourself. Just tell me you're not feeling yourself, and we can talk about your hormones. But please get your hormones checked at the very least, because that's not being checked. Honestly, the guys that do get it checked when they're retired, it's because they specifically have to like ask repeatedly for it. They're being treated for depression rather than probably hypogonadism, which is a big one with
Absolutely. Or like with TBI, so many times with TBIs, you stop producing your testosterone, and testosterone is what you need to heal.
all the things. Like it all works together.
It all works together.
But it's frustrating that it's a simple blood test. Like it's literally this like, but then also we can talk about the reference ranges again.
Yes, and two, it's something that can help in so many ways, and it's what our body makes. Like our body, like when in the beginning of the conversation you said I hate telling people it's life changing, and same, because then people look at you like, okay,
You're just here to like make me get hormones and like,
every cell in our body has a testosterone receptor. Like our body needs it to function.
all right, I'm going to talk about the reference ranges for just a second because like I was just talking about these retired guys, right? So they're retiring, they're probably like 45, 50 now. So that's still really young, but they're going to their doctor and, or if they get it checked, their testosterone might be like 450, maybe 500. Okay, you're normal, it's fine, you're within range. They peaked when they were in their 20s at like 1200. That is not normal. And then I have these young guys who are like, and I'm seeing it all the time, and it just breaks my heart because they're like, well, not even 30, and their testosterone's literally like 280.
And then I'll be like, I kind of joke to make it light sometimes, but I'm like, I have more testosterone than most guys, which is so sad. And that's why, like, you go get your blood work done if I was a guy, and the normal range of testosterone is what, depending on the lab, like 228 to 828, which one is a huge range for anything. And then once you know the normal range of blood work of testosterone is the average of the population, and we're getting sicker and the normal testosterone decreases every year, hopefully that makes you feel better. Like,
But I don't think people like know that. Like they just, and I don't even know that like a doctor's, they look at the reference range and it's like, oh, you're fine. But did you not notice that it's changed over the years? Like, why is it changing? Like, well, we know why, but,
or like why people, including doctors, think that women need more estrogen than testosterone. It's two different units of measurement.
and where does estrogen come from?
Exactly. Testosterone.
So why would we need more estrogen than testosterone?
Yeah. But it's just, it doesn't make sense. And that's why education is so important. And just, I feel like just explaining to people what normal range means, it's like, got it. And where like our ranges come from, it's like literally just what our grandparents were at before these environmental toxins have made us so much lower. And then of course, then you add into, the military, PTSD, TBI. So it's like, okay, they're already lower. Then adding, so many that's going to affect it to go even lower.
Yeah. That's what I tell them. I'm like, okay, this is why a lot of people have suboptimal testosterone anyway. I talk about the environment first. And I'm like, but then you have this, which is suppressing all the way over here. And then like explain all the things that are working against their natural production of testosterone. And they're just like, oh, that makes sense. But it's, what do I do? And I'm like,
Add some testosterone.
yeah, I was like, I can help you with this, but you got to do lifestyle stuff too.
Even to totally different topic, but postpartum, right? So when you're pregnant, your testosterone, estrogen, and progesterone that are highest are ever going to be naturally. No one knows that, right? They might think estrogen, progesterone,
Because why? We don't talk about testosterone for women ever.
even though that helps form the baby, but that's just a side note, I guess. And then as soon as you deliver, they go to zero. And then their doctor at their 6-week appointment was like, oh, you'll get back to normal. But what's normal, right? We're already lower. Now it's low. Yeah, that's why I think I feel like when I talk about optimal bio or what we do, I repeat bioidentical 27 different times and the ranges because I feel like those two things helps explain so many other things.
The definitely the difference between bioidentical and synthetic, but also yes, the reference ranges because how many people do you hear say, "Oh, I had my labs done and they're normal. They're within range. It's green," because the little now they have green. So,
Green is good, even though you brain fog, fatigue, you can't sleep.
I'm like, really? Like, let's talk about what a reference range is and why that doesn't matter.
Because it helps like making it tangible to someone, and then hopefully then that makes them feel better, like, okay, this is why I feel this way, it's not just in my head, and there's a solution that can help you feel better day to day and then keep you healthy as well.
That's yeah. That is like my favorite thing is when I go over labs with someone and there is obviously most times it is suboptimal or whatever. And I'm like, well, this is pretty low. They're like, so I'm not crazy. I'm like, no, you're not crazy.
It's like, nope, this explains pretty much everything you're saying to me right now.
But with the guys or even the women that come in with the PTSD and TBIs, my favorite thing, my makes me feel like I just love it, is when they come back and either they're telling me that they feel great and they feel like themselves again, or their spouse is with them. And sometimes their spouse will come in like literally, at that 3 week mark when they're peaking for their own consult. And before they even talk about their symptoms, they go on and on about how they got their spouse back.
Yeah, which is, you can't replace that.
You can't. And it just makes me happy because I'm like thinking about them, but also their kids and like just the change.
Absolutely. And that's why it's like why we show up every day. And people can always say, like, you're mission driven. Of course, that's what you want for a company. But I truly believe, like, we want to change healthcare because we want to change people's lives. And that's why what we do every day.
I am huge on quality of life over quantity, honestly.
And too, especially like, oh, you're gonna, what's the retired age? Like 55 or something? And they're like, then it's like, that's when like your life just kind of supposed to like stop. I'm like, that's like prime time. Like,
Don't you want to like live now? Like you're done. Like
And that's the thing, so many symptoms of aging. I was like, oh, it's because I'm aging. It's like, no, it's because of lack of hormones.
Exactly. I'm like, is it aging? Is it, I don't know. But if you are 55 and you have diabetes, they don't stop giving you medicine.
Exactly. Exactly. In our Cary office building, their project manager came and said hey to us one day, and there used to be a primary care next to us, and he's like, it's so crazy seeing the difference of the patients coming out of your office and the patients coming out of that office, and we notice it too, obviously, and it's like, yes, it's so sad as well because so many things can be prevented.
That's the thing. It's prevention. And we know why this isn't pushed, like preventative medicine is not first line anymore.
We're trying to bring it back.
Yeah, it should be. But I don't know. I just want everyone to be aware that just because someone looks healthy on the outside doesn't mean they are on the inside. And I'm not just talking about like heart health. There's a lot of things that come with your hormones and other things being off, but also the brain, those TBIs, and it's it's frustrating that people look at these guys and women and well, they're not at home with them, so they're not seeing them, seeing the cover.
The best part, right? The act that you put on every day.
Yeah. So that's my biggest. That's probably my biggest why I love what I do now. I still help my women,
100%. Exactly.
and I feel like I'm still helping them by helping their partners.
I think is great. And the conversation about hormones and testosterone is just getting bigger. I feel like each month right now, which is great to see. But especially when it comes to the military, I hope there's more conversations around what they can do to help them when they're deployed, when they're home, when they're retired, because that would make such a big difference.
That's like one of my biggest pet peeves with the military. Well, I have a lot, but that one. Um, they have done so much research, literally on testosterone, TBIs, all of this stuff. They know what's going on. They know how to fix it, which is super easy, like replace it, right? But they don't. It is, and I'm just like, these guys are, and women. I keep saying guys because most of the guys are the operators, but they're literally breaking down their bodies, like internally, mentally, all the things, and then you use them up and you toss them out. Like you're not thinking down the road.
Yeah, no, exactly.
So that's very frustrating to me. But
It is. Well, we appreciate what you're doing and changing, so many people's lives in that community.
I'm glad that I found Optimal Bio, honestly.
Oh gosh, I know. I will never forget when you applied for Cary, and then I saw your address. And I'm like, hey, would you want to work in our Seven Pines office?
It was perfect. And all the patients, I love them. I do.
It's a great group. Well, thank you. This was great.
Thank you.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brandon, Medical Director Greg Brandon, podcast host Tyler Brandon. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.